Yeah, so we've got 3 speakers. So we have a talk from the Global Digital Foundation that will be talking to us about AI and their AI Assurance Club. And then following that, we have some colleagues joining us from Welsh Government to talk about the AI landscape review. And then we have Baxter Healthcare joining us, and they're going to be talking to us about their use of a shared smartphone solution. So so hopefully you'll all agree that some really interesting talks. So on the basis that I'm under strict instructions to ensure we run to time, I'll stop talking now and hand over to colleagues from Global Digital Foundation. I'm not sure. I'm just looking here now. So is it Rob Wortham, Dr. Wortham? I'll hand over the floor to you.
I'm not sure if he's joined the call yet. Might have to rejig our agenda.
Can't see Rob in the
Waiting room. That's what I was hesitating. Okay.
Shall we go on to Louisa, because I know Louisa's here, and I'll message Rob and see what's happening just in case he's been held up somewhere.
Fantastic. Is that okay with you, Louisa?
Yeah, that's fine. I'm poised for action.
Fantastic. In which case, the floor is yours. Thank you.
Brilliant. I say I'm poised. There'll now be a short pause where I remember how to share my screen. Oh, I'm fine then.
Thank you.
Can you see that?
Yes,
Yes.
it's in a corner of the screen for me. I don't know if it's the same for others.
yes.
There, that's perfect. Thank you.
Very strange. Do you see that full screen?
It's not quite full screen, but it's clear enough, I think.
That should be better.
There, that's perfect.
There we go. Perfect, thank you.
Sorry about that. Hi. Yes, so this is some work just looking at the landscape of AI in health and care in Wales. It's not a complete census of everything that's going on, so I'm sure that every single one of you will know some stuff that I haven't covered in here. It was commissioned by the various chairs to get an overview of the kinds of things that have been tested or implemented or tried in Wales, where we are that, and some exemplars of AI in health. And then also really to understand some of what the opportunities and barriers are to further adoption of AI and make some recommendations around that. So I probably don't need to labour the point here about what AI is. We don't have a formal definition of AI in Wales at the moment, although I think the UK, England and Scotland they do. So I've used this one, the simulation of human intelligent processes by machines, especially computer systems. More and more we've kind of widened it so that it becomes more synonymous with data products, which is not really what AI is, and machine learning, but perhaps there's an opportunity in that as well. And we tend to jump to the kind of cool diagnosis, cutting edge kind of stuff when we think about AI, but it can also be used to speed up operations, to improve operational quality, as well as those kind of diagnostic things, and perhaps even to save money. And there's a whole range of different ways of work.
Off the yeah.
Sorry, can you hear it?
Just ask everyone to go on mute. Sorry, if you're not speaking. Thank you.
So we start off with the question, where are we now? So here are some examples. Like I say, this is not a census. You could split out different AI use cases in many different ways, but I've split them into health promotion and prevention, diagnosis and treatment, and operational efficiency. And the boxes going along to the right are things that are operational being used in Wales, things that are operational outside Wales and doing research or prototype. The numbers aren't representative. These are just some examples. And later on also, if people are interested, I've got links to these particular examples as well. It'd be great to have more in here. I think looking at that, though, we can conclude that if we were to use the Gartner AI maturity model, we're probably somewhere here around level 2, where there's experimentation, mostly a data science context, not so much in production. So probably somewhere around here. It's probably different for different people in different organisations. And then this is my non-numbers based cartoon of where we are. There's been a lot of research into AI for health. There's been quite a lot of prototypes tied, but actually the things that are operational are a much smaller part of that. And one of the important things is thinking about how we get from that academic research and prototypes into operations. Operations is supported by skills and infrastructure and governance. So those kind of green boxes need to grow in order to feed into increasing the size of the operational green circle. So what are the barriers? What are we already doing to address them? What more could be done to address them? So a few things. What are the barriers? A lack of skills. This isn't just about having data science and AI skills, although those are important as well. There's a lack of skills really around intelligent customers as customers of digital and AI procurement, which can, it can lead to chasing the shiny things which don't work, or it can lead to cynicism, nothing ever works. There is probably across Wales, we don't have a lot of the digital data and technology professions. So I'm thinking not just about data science and AI, that kind of technical bit, but also around user research, service design, delivery management. And those are the skills that bridge that gap really between academia, research and prototypes, and actually delivering something that works as a service. And then also, although this is changing, around AI, digital and data literacy. So understanding what it is and what it can do, even if you're not the person who's going to do it. I don't think it's a surprise to any of you that we're on a journey with digital and data maturity. We've got lots of legacy systems, proprietary systems, lack of interoperability, all these things make AI easier. And we don't yet have a single set of digital and data standards and governance. Talked a bit about that gap between research and prototyping and implementation. There's a different set of skills you need to bridge that gap. If you build your prototypes on a research platform, it's quite hard then to turn them into operational systems. So how do you do this? And there's also a big question about corporate risk appetite, particularly for diagnosis. The regulation hasn't really caught up with what's possible, and that makes people quite wary of taking it on. But not all AI needs to be used for diagnosis. There are other ways that you can get value from it. And then obviously what I'm here about, we don't currently have an AI strategy for health and care in Wales and a roadmap. So we're going to look at the data maturity model. We're probably again somewhere between 2 and 3, although obviously there's a lot of work going on to move us further to the right here. So what are we already doing? There's already quite a lot of stuff going on. So DHCW are mapping the digital data and technology skills from GDS to NHS bands, which will be really helpful in being able to define what skills we need and give people a career pathway for those skills. We've already got some talent pipelines underway. So we've got the Welsh Government funded degree level apprenticeships in software engineering and data science, which I know we're taking advantage of here in Public Health Wales, and also the data science graduate programme, which is run by ONS, which we've also got here in Public Health Wales. So a review of the health informatics apprenticeship by HEIW, which I think is interesting because we can feed some of those newer and missing skills into that, and a growing strength in digital leadership across the board. We have, so a lot of these questions are intended to be answered by the National Data Resource, particularly around digital and data maturity. And I think in the gap between research and implementation, we've got a growing set of examples to draw from. The NDR platform, as envisioned, would allow both research and operations on there, which would be great. And there's quite an ecosystem of organisations which are here to support us adopting data and digital and AI in Wales, some of whom I've written down here, like the Life Sciences Hub, like Tech Cymru, Centre for Digital Public Services, Health Technology Wales. I'm sure there's others there that I should add as well. There's a lot of work going on ethics, consent and regulation. And I think in terms of that corporate risk, the examples of AI that have been successfully implemented tend not to be medical devices, but we still get value out of that. And I think that idea of thinking about human in the loop decision making is important as we work through some of these things, which is new to everybody. And then in terms of strategy, well, working together with Welsh Government and various other people, including the Welsh Institute for Digital Information, collaborating on how we can pull all of this work together, and all your comments and feedback from today as well into something that feeds into the strategy, whether it's a separate strategy or part of the overall digital and data strategy. There's already a lot going on. What else could we do? I think in terms of skills, there's more we could do to embed digital and data literacy across the professions, not just the analytical and digital professions. Something about creating professional standards and competency frameworks, career pathways that DDAT professions have been really useful. And I think another bit which is about how we facilitate the art of the possible. And I guess this forum is part of that, people talking about what they've done, sharing what they've done so that people can see what's possible and learn from each other about what works. On digital and data maturity, I think having those standards around AI has been work done in various places that we can bring in, having good governance and effective training. We don't need to each individually reinvent the wheel. We can work together to share what we do, to have one set of standards. We have one set of standards, it's easier to work across different organisations. In that gap, the valley between research and implementation, I think something that people have learned is that strong user engagement. So working with clinical staff, working with the users of the services, as well as with working with academics who've developed the technical solutions, is vital for successful implementation. Be useful, I think, to have a map of all the different support, so that if you're going, right, I want to do AI, I've seen this thing, these are the different people you need to go for different things, so it's clear who does what. There are funding opportunities. There's the AI in Health and Care Awards, which is £250 million over 4 years. And I think there's only one example of that that's been tested in Wales so far. So there's things that we can tap into. The Multi-Agency Advisory Service for Artificial Intelligence is looking at how to support people with guidance and support people through the legislatively and regulatory aspects. They're keen to come to Wales as well, and they've already done quite a work. They've got quite a bit of work. They've got a beta on at the moment that they're testing for people who want to use AI, and also for people who want to be able to produce as suppliers of AI products. We can champion better regulation, and perhaps also we can focus on collaborations, how we not off-the-shelf solutions, which are often difficult to implement, but how we collaborate to learn from other people where it's worked elsewhere. What are the things we can learn from that to bring in? On the AI strategy, I hope we can incorporate these findings into a vision and roadmap and recommendation for AI in Wales. It'd be really good to hear your feedback on this as well, either now or in writing or follow-up conversations. We need to make sure that there's not just a robust economic case, but we understand, there's a danger that it's chasing the shiny thing. There are real reasons for wanting to use AI. If we think where the health system would like to be in 10 years' time, we probably can't ignore it. So making that case and understanding where it's useful and where it's not. And related to that, making sure that whatever we do with the strategy, we build in an evaluation so that we measure benefits and we do what works. Next steps. What is next steps? So we want to set out the requirements for an AI strategy, working with yourselves, the Welsh Government, WIDI, wider stakeholders, and incorporate that strategy into plans. So that's the next step for this piece of work. I'll also give you a heads up that the RSS Data Science section is planning a panel session probably next month on, always have to have a provocative title, why is AI in health not working? So if you're interested in that, I can share when we've got that date set when that is. And that's it, because really, rather than me talking, I'm quite interested to hear your feedback and thoughts on this. Where do you see the biggest opportunities? What are the barriers for you to implementation? What are the things that would most help you overcome those barriers? So I've ended, instead of questions for me, questions for you. Thanks.
Thanks, Louisa. That was fantastic and really, really supportive, and pleased to see that plans are afoot to pull all of this together and really get a plan and a strategy in place fairly soon, actually. So you've got a lot of work to do, I guess, in the next few weeks. Is that where we are? Brilliant, brilliant. So I'm going to invite Phil to come in with a question while the rest of you, or not a question, a response, while the rest of you are gathering your thoughts. Phil.
Thanks, Carrie. And Louisa, excellent piece of work. I actually picked this up with Andrew Ware last week. We were at an AWS meeting, okay, right? So the bits that the report don't cover, which you might want to consider, right, is cultural and behavioural aspects to lack of acceptance. Yeah. And the other one is we're at least 10 years behind the design thinking of stuff, right? So we've moved on from this monolithic data lake type approach to data analytics, and we're moving into mesh networks. I don't want to go too long because somebody's drilling in my house and you just get drilling going on, right? So I think that there are other aspects that we need to consider. There are some use cases. We have been contacted around the innovation strategy for Wales to put some of the stuff that RIW have been doing, and one of them is trying to deploy the Fuji camera, right? And we've had massive cultural and behavioural barriers to it, not technical ones. Yeah. So I think that the culture and the behaviours of people need to be put in there, and sometimes they are the greatest challenges to the adoption of the technology, and it's not the technology that's the issue.
Yeah, thank you. I'd agree. The technology arguably is the easiest bit. Creating something that can do a task is less compared with the infrastructure and the cultural bits.
And I think it might be useful listing the opportunities that are available for already federated, licensed and approved AI technologies that we just haven't adopted or scaled up because of cultural or behavioural issues. Okay, so part of this isn't about trying to find the new stuff that everyone's doing. It's there's lots of existing stuff that could be implemented that we're just not.
Yeah, I think that's true. I've got more. I didn't want to spend all of my time talking about the case studies. There are more, but I'd be more than happy to hear of other people's examples, particularly if you've then tried to implement them and success or otherwise on that. I think the other bit that's missing here is that we don't really have the voice of the private sector, who are probably going to be involved in implementing a lot of this.
And you mentioned in your talk, Louisa, the AI in Health and Care Awards, and actually, you know, we really did try to bring forward many more of the successful innovations into Wales, and struggle to identify sites that were able to take them forward. So there is something about really understanding that route to adoption, and exploring, you know, is there a way that some of this can be written into IMTPs or into some of the planning and strategy work up front, so that actually we're setting some adoption targets. I've got a couple of hands up now, so I'm going to go first to Jenna and then to Paul.
Hello, my name is Jen. I work in radiology in North Wales, and recently, I've been working with AI a lot in radiology. AI in radiology is slightly different, as in terms of it will probably never replace a radiologist. It's more of it will work in combination with a radiologist. But some of the issues and barriers that I've been experiencing is the number of I've just won an award to do a research project, and it's not a complex research. It's basically validating the AI on local population using retrospective data, anonymous data, and the number of paperwork and regulations that I've had to go through to get this done has been phenomenal. If we could have potentially implemented this without doing this, because it's already FDA approved, CE marked, my question is, how do we overcome all of this kind of so what I'm talking about is I've had to do a DPIA assessment, I've had to do a cybersecurity form, I've then had to do a business mandate IT assessment, I've gone through R&D. Could we have could we have an umbrella that kind of encompasses all of this, because a lot of it is duplication, and B, would that umbrella kind of cover radiology, and I'm sure that kind of the same issues are elsewhere, could that cover when you're trying to pilot or implement? Because my question is, nobody will want to implement if they have to do this for every single piece of AI. You know, so how do we overcome all of this kind of NHS paperwork? It's been a bit of a nightmare.
That's a really good question. I'd quite like to follow up with you actually outside this conversation so you could talk me through your pain, because I think that idea of mapping out the way so that you've covered all your privacy and security and ethical issues, but you do it in the least painful way possible, is really important in thinking about this.
And our last question for you, Louisa, is from Paul.
Oh, thanks, Louisa. Just really great presentation. Thank you for that. I just want to mention, hopefully you'll hear something from Baxter very soon, and which will help with some of your potential issues. But leaving NHS Wales recently, I did some national projects or national programs even, particularly around cancer and pathology. So one of the things that I noticed, the sort of variation between different areas, very limited, sort of like standardization as such then. So just listening to what Jenna said about cancer services, I was doing some work around nuclear medicine and cancer in Wrexham Mylor, and that would be totally different as it is in South Wales. So the variation between the two it can be quite significant, obviously population based and so on and so forth. But certainly the approach to AI is going to be, you know, obviously it doesn't fit all, I guess. So if we are looking at a sort of a national footprint down, just bearing in mind the sort of cultural levers, I think, as Philip was mentioning earlier on. So, and very much the people wanting to do certain things in different parts of the country. So absolutely. So hopefully some of the things you'll hear from Baxter shortly will help with some of that.
Great, thank you.
Brilliant. Thank you, and apologies, Adam. I'm not gonna come to you for question, but what I would like actually is if you're happy, Louisa, if we can just share your contact details with the group, and then maybe there can be the opportunity for follow-up after the session. Would that be okay? Brilliant,
yeah,
great,
fine.
thank you. And apologies only because I know we've got two more speakers we've a busy agenda for today. So I'm going to take us now to Global Digital Foundation. And oh, thank you, Louisa. I see now you've put your contact details in the chat. That's brilliant. And can I invite Dr. Wortham to take us through your presentation and tell us more about the AI Assurance Club?
Yes, thank you very much. Thank you for the invitation to speak this morning. I'm very grateful for that. My name is Rob Wortham. My background is as an engineer, really, and developer and entrepreneur of software systems. And then latterly, I completed a PhD in computer science, specializing in autonomous systems, and ended up heading up the MSc at the University of Bath in robotics and autonomous systems for several years. And then I oh dear, not now. I'd like to share my screen. And every time I click on it, it says I need to. Okay, so there we are. We seem to have got that sorted. Use Teams very often nowadays. I used to use it a lot, but I'm hoping you can still see me and you can see the presentation now.
Yeah, that's working well, thank you.
Yeah, lovely. So jolly good. So I've been involved with the Global Digital Foundation since March this year, and the Global Digital Foundation has been around since 2017, founded by John Higgins and Paul McDonald. John was previously representing UK tech in Europe, and was very keen to try and see how we could maximise the benefit for AI in the UK and the uptake, because obviously there's quite a lot of resistance. So the need for AI assurance, and I'll explain more about what that is, but the need for AI assurance really is growing. So we have regulatory and compliance risks. We heard something already this morning about the amount of paperwork that you have to fill in at the moment. And this is because people are very concerned to make sure that they obey the regulations, even though the regulations are still formative at the moment. There are big issues around cybersecurity and privacy, product liability. If you're a manufacturer of systems that have an AI component to them, then you're very concerned about your product liability and legal certainty, where you stand on all of this. And then, of course, there's a backdrop of public trust, and there are challenges about how much people trust automated systems that make decisions for them. And in fact, they tend to mistrust them considerably. So providers, much the same as in a financial setting, providers of AI-based systems need to rely on assurance from their supply chain as well. So typically, when you build a system that includes AI components, it's not monolithic. It's not one company that's produced all of those components and then it's then delivering them to the customer. You know, components are developed. That might be tools and frameworks that are coming from big tech, and then AI models maybe come from other providers, and then the training data, and then specific data that's taken to maybe train those systems, train the later layers in those systems, and so on. And then all of that is incorporated into a system that is ultimately making decisions. And that's the key thing about AI systems, is unlike previous systems, tech systems which store data, retrieve data, and would process data and provide reports in various forms. Essentially, that's really what big tech systems used to do, and then communicate real-time messaging between systems. Perhaps with the advent of AI, we're looking at decisions being made based on data, and often based on historic data, and then systems that are making decisions. And so the public don't trust this. So the AI assurance ecosystem, which is we're interested not just in the UK but also in Europe, and then we'll go a little wider than that. But you know, we're just in our first year of operation at the moment, so we're focusing on UK and Europe, and the ecosystem is developing very rapidly. And really, what does the ecosystem consist? Well, it consists obviously of the public. It consists of clients, people who are taking AI systems and deploying them. In that sense, the NHS would be a client, but also regulators and suppliers and certification bodies. And we have a mix. All the people who are members of our AI Assurance Club come from all of those sectors. And really, what we're doing is trying to create a dialogue about how we can address this issue of falling trust, how we can reap the rewards whilst managing the risks. That's the key thing. So we have a positive approach about the use of AI in problem solving, but how do we manage those risks, and how do suppliers, how do they do business? You know, a lot of large corporates are effectively just standing back from AI at the moment, saying we don't really want to develop it or offer it in our products because there is a bit of a regulatory vacuum. Okay, and also we have assurers. So this is people like Ernst & Young, PwC, those kind of guys who have a long track record of assuring financial systems, and are now moving much more into assuring systems that contain AI. Okay, so the story so far. So in 2021, we worked in detail on a framework for AI supply chain assurance. So this is the way in which you would actually have an assured value chain. And we developed a pilot framework to do that. This was just before I got involved, and that idea was then market tested with a whole lot of big companies. So we basically contacted senior execs in all of these companies and wrote a report, which is accessible on the website. But the conclusion really is that it's a great initiative to try and develop a kind of minimum viable solution, but it's too soon because the requirements and the ecosystem are still at a very formative stage. So in 2022, in April, we established the AI Assurance Club. The first meeting was in June in London. Second meeting was in July in Berlin. I've just got back from Milan last week, where we had another follow-up meeting. And this is an opportunity for all ecosystem participants to engage, discuss, develop best practice, and form sector-based assurance frameworks. So we're not saying we're coming to you with all of the answers at all. What we're saying is we're coming to you in order to develop a dialogue and let you meet other people in the club that you feel you can work with, and develop frameworks for assurance within your particular sector. And as regulations and standards emerge and crystallize, you know, the AI Act will come into law probably in the early part of 2024, but that's still a bit questionable about the timeline for that. And then we've got in the UK, we've got work happening, DCMS and CDEI with their sort of proposition that they put forward just over the summer about their kind of strategy for sector-based regulation. So the existing regulators in the sectors in beefing up their capability so they can regulate AI on a more ex-ante kind of basis. So we're really trying to support our members to help them position themselves at the forefront of best practice and risk management. So what are we doing? Well, we have a three-strand approach: engage, monitor, and create. Engaging, well, we have these meetings every month or couple of months with guest speakers. We've had, as I say, now 3 of those very successful meetings. And we get people really either to focus on something very specific, like elements within the EU AI Act and what the implications. We had a very interesting lawyer in Milan, for example, who picked that apart and said, well, these are all the things that the AI Act doesn't cover, and therefore there isn't legal certainty going forwards. So we have these very interesting meetings, and people are then forming links at those meetings, getting to know other people they didn't know. So we would try to create a forum, and we do it in person because we think that's the best way to get people talking. And we offer a lunch or a meal or whatever, just a more forum, more way of getting people to talk together. But they're also hybrid, so if people can't come, then you can access them online. There are recordings and photos and stuff of the previous meetings. Not Milan yet because it was just last week, but we'll get that up shortly. And then there's an opportunity to sign up to a manifesto and show visible support for the need for assurance. So you can just say, look, we are participating with this group of people in order to look at how we can move forward in this area. So that's really the first strand, engaging. The second is our ecosystem monitoring. So we monitor, there's obviously lots of newsletters around the regulation side of AI, but we're focusing particularly on assurance. And so we produce a monthly newsletter, and we produce white papers and other outputs as well. So I'll mention in a moment, but we produced a global trends report, which is looking globally at all the regulation and assurance and governance initiatives that are going on in the world at the moment, split that by region, and then looked at particular countries of interest. That's a 40-page report, which is actually very well worth you scanning. Freely accessible on the website, just download it. And then our third strand is creating. So this is just a shot from our meeting in Berlin. And we're looking at establishing work groups to develop sector-based outputs. And one of the reasons I was very keen to present at this forum today is that we're not strong in healthcare at the moment, and we'd like to be stronger. We'd like to have more representation from the healthcare sector, and so we'd love you to join if you think there'd be value in doing that. And then what we're trying to do is to get people together to form groups where they can look at how they can work together in on specific problems across multiple. Well, I was going to say companies, but in your case, companies doesn't quite apply. Maybe different health boards. But we have, we've got big players like we've got Huawei and we've got SAP at the table and Bosch. So lots of big players at the table. And the idea is they're going to focus on specific challenges that they have in their business for the deployment of AI and look at developing frameworks for assurance just within those sectors. Over time, we'll produce case studies and we're contributing to regulatory developments as well. So we produced a feedback to the request for information that DCMS put out over the summer, and you can find that on our website too. As I said, there's a website. You can go and find out much more about us at the website, look at the background of the meetings that we've had. We have about 140 members at the moment, and they're mainly senior executives from large companies. But you're very welcome to join up. There's no commitment beyond agreeing to receive a monthly newsletter and future event invites. That's all we ask that you do. Please do, as I said, have a look at our AI Governance and Assurance Global Trends report, which I think is very illuminating. Okay, that's all I wanted to say, and I wanted to make sure we'd left enough time for questions. Thank you very much for your attention.
Thanks, Rob. That was really, really informative and interesting just to see how the network is growing up on a global basis. I'll throw the floor open for questions. Obviously giving us all the information that everybody thinks that they need. Oh, here we are, Delith, come in.
I was just going to ask Rob, thanks for that. That was really interesting. How do people, if they want to join the network, how do people do that? And is there a fee or anything, a membership fee? Or
Yeah, okay. So you just go to the website and there's a join menu. You just put your basic contact details in there and select which things you'd like to receive and click, and that's it. In terms, there's no cost at all. There's definitely free for all our members. We're effectively funded by big tech. Is how this works. No, for individuals or for organisations, we want to make it free to join. Absolutely.
And we'll pop the link then to your website in our follow-up email that goes out to all our members along with the recording, so
Lovely.
people will be able to find that easily then. Thank you.
Brilliant. Thank you so much.
Oh, thank you, Rob. Really appreciate you joining us. That was great, and we'll follow up. So that'd be brilliant. Thank you.
Yeah, thank you. Thanks.
So as I said at the start, guys, we've got a busy session today. So I'm going to move us along quite quickly to our third speaker. So can I introduce Paul Williams from Baxter, who is going to take us through his presentation. Paul, the floor is yours.
So carry on, slight change of chairs. Lindsay's going to open up for us. So
okay.
Thank you. The art of delegation. So thank you guys, an absolute pleasure to be here with you this morning. I've just got literally 3 or 4 slides to kind of walk you through, but it was extremely interesting to sit through the earlier sessions to really understand where you're at today in terms of AI and common challenges that I think regardless of what forum you sit on around, does it work, how do you procure it, adoption, implementation, so I'm going to try and cover off some of those topics or threads as I work through those few slides. So as I said, my name's Lindsay Hilton. I'm responsible for connected care and value at Baxter Healthcare. And just a tiny bit that I think is relevant about my background. So I've had some early experience with AI working outside of the UK. So I've only been back in the UK for the last year. I was working in the Middle East, Africa and India, where we were exploring different types of digitization to really accelerate the way medicine was heading, providing infrastructure. So lots of things that I could bore you with as regards my background, but super passionate about healthcare and transformation. So first and foremost, Baxter, diversified healthcare company, 7,000 products, I think now, including software, and constantly looking at different ways to support healthcare systems. So I thought it's really important to touch on what our legacy is with Wales today. What do we currently do to support the work that's happening locally? And then ultimately, where are we heading and how do we support some future progression? So some of you may be familiar with a system called ICNet. ICNet is our infection control surveillance system software that currently sits in all hospitals across Wales. So you talked about how do you make it happen, adoption, implementation, change management. We would absolutely be prepared to share our experiences as to how we made that happen, and do have a dedicated team that support that in Wales. So very happy to talk to you about that. So what is ICNet? As I said, it's an infection control surveillance software that basically pulls in different types of data and insights to identify patients of interest. And I'll talk to you a little bit more about that data shortly. but it is the only platform currently that provides that seamless solution from both the hospital and public health settings. So we don't just sit focusing primarily on infection control in that acute setting. We're also really keen to take a look at what that means from a community perspective. And again, I'm sure you'll all agree that that's extremely relevant within the current environment we find ourselves in with resource constraint, and also more direction to treat patients closer to the community. So there's lots of information out there, but in terms of presence, we're partnering with more than 1,200 facilities. So something, again, that people are very familiar with. And I highlight the importance of familiarisation, because there was that question posed by Louisa at the start, you know, is it tried and tested? Does it work? Can you demonstrate that it works? So in terms of where do we pull all this data from to create this surveillance system? Well, you'll see a list on the left-hand side of the multiple different data feeds that feed into ICNet. So again, I'm sure all of you are familiar with these things: ADT, lab, pharmacy vitals. And I just pull out patient notes because we do have AI functionality within the patient note element, using neuro-linguistic programming to analyze clinical notes for keywords that could ultimately change the outcome. And then what does ICNet then do with all that connecting data? It basically generates targeted insights. So dashboards, alerts, reports, in this instance specifically around infection control. But what we are finding is expanded use cases where people are using this information, no surprises, because it's a pretty substantive data warehouse, to pull out sepsis, to pull out early diagnostics from a cancer perspective, haemophilia, diabetes, you know, so the use cases I go back to for ICNet are expanding significantly. And then once we've got those generated targeted insights, the hospitals then develop workflows associated with those insights, which again drives significant change from a resource perspective. Absolutely, you know, evidence that we have around the use of ICNet shows optimized care, improved outcomes, and of course a better experience from a patient perspective. So if I had to summarize all of that, and you can see an example of it here actually deployed, it really is holistic data collection, so a really rich environment integrating as many data sources as the hospital is in a position to integrate. We have the opportunity then to create meaningful data visualization, so having those generated workflows, alarms and alerts in the palm of your hand, and then ultimately providing a position to coordinate case management. So where I would say ICNet has really come into its own in the last few years is in the majority of occasions. ICNet has been used as a single source of truth for COVID. So we've got a lot, again, of experience in that kind of system-wide deployment. So it really poses the question in terms of where we're going, and I know that the talk of the conversation was around mobile technology and phones. And we recently acquired an organisation called Hillrom specifically for their digital products and their digital services, because the way I liken ICNet is you find that needle in a haystack, you find that patient of interest, you absolutely want to make a difference, but how then do you communicate that insight to the caregiver, the person that's actually standing at the bedside and ultimately wants to make a different decision potentially for that patient? And that's where we would introduce Vault. So Vault Mobile is a configurable software used by communication teams, and that communication can span from a patient all the way through to any element or aspect of their care team. And what it would take in this instance, and I think specifically about Wales based on your position with ICNet, is you have the ability to text information, secure messaging with read, receipt and acknowledgement. So you've got that auditable pathway of demonstrating your workflow. You would then potentially use voice for any urgent or critical calls, as opposed to, you know, that frontline opportunity to communicate that insight. And then the last element or aspect is around alarm and alert management. So Vault is not new by any means. We haven't, or we're in the process, and again, this is my ask from this group, of identifying partners to work with us across the UK, but Vault has been in operation since around 2015 and is in more than 300 hospitals across the US, with close to, I think now, 500,000, if not more, users on the system. And what it basically does is it provides one place for all your patient information. So you've got that chat functionality, you've got all your patient stats, which is directly pulling from those data feeds. You can integrate directly into your EMR or ICNet in the potential instance for Wales. The future, we're hoping to integrate things like waveforms, and at any given time you've got access to anybody within that care team. And I think that's often the challenge. You know, you find this really important piece of information you want to communicate to people, you send an email, you bleep, you page and pray, I've heard it being described before, you know, and you just hope that all of the kind of hard work, effort and energy in creating that insight reaches the right person, and then they act on it. So that's it for me. I literally wanted to give you a flavour of where are we now in terms of the work that we've done historically with Wales, and absolutely open up the offer to support some of that work around implementation, standardisation. We go through the exact same hurdles every time we want to introduce any technology into the NHS, and I don't think you're going through anything different as you try and install different types of AI program. And then just to really ask the wider group, we are looking for partners, we are looking for people to make this live with us. As we said, we've more than 300 hospitals that have deployed the Vault system across the US, but we would really like to work with local partners purely to develop and generate evidence. So that's it from me. I see some nods, which is always good.
Fantastic. Thank you, Lindsay. That was really, really interesting. And if I'm following you correctly, then, you know, we have the ICNet system operating in Wales. So this would just be kind of taking it to the next step.
Yeah, it would be. And that's the thing, you know, this is the feedback we get directly from people. There's a small kind of closed group of people that have exposure to ICNet, specifically in infection control in this instance, and they generate that insight. They go, this is the patient of interest. We absolutely want to do something different for them. And then they've got this sophisticated technology, and then they revert to picking up a phone, waiting 25 minutes on hold, not necessarily getting hold of the person on the ward potentially. And what we're really looking to do is, how do we take these really fantastic insights and take them directly to the bedside? Thank you.
So guys, I'm just looking, no hands up at the moment. Any questions that you'd like to ask Lindsay and Paul?
Oh, there we go.
Debbie.
Hi, Lindsay. Thanks for that. Just a quick one. As regarding ICNet and infection control, do you include hepatitis B, HIV in that data set or not?
So what I think would be really interesting is let's take a look for your specific organisation as to what information is currently captured, and then we would be able to let you know if that's the case. So the way the ICNet system works is we don't just pull out information solely for infection control. We pull in all of the information, and then it basically filters specifically for infection control metrics. So what I don't want to say is, yeah, it's absolutely there and then it's not. I think it'd be better to say, let's take a look and see if that's okay.
Yes, so I work for Life Sciences Hub too. So a conversation with you offline about it in more detail would be great. Yeah, thank you.
Yeah, not a problem at all. Thank you.
Brilliant. Thanks, everybody. So I'm not seeing any more hands up. So you've got off very lightly, actually, with questions today.
I know.
So yeah, no, but we'll follow up with you. So so really we'll be keen just to explore how we can build those working relationships, Lindsay. So so yeah, we'll be able to pick up on behalf of the overall system. So thank you very much for your time today. We've managed to get the 3 presentations in within the hour, so I'm delighted with that. I wasn't too sure at the start of the session, we'll get the transcript of the meeting sent out to you guys in the usual way. But it's nearly hard to believe that we're not going to all get together again now until the new year. So so we have hopefully lovely Christmas and New Year period in between. And I think I'm looking at Delith as I'm saying this. Is it the 17th of January that we're all next together?
Yes, that's right. And just a bit of a plug as well, because I think I mentioned in our last call last month that we were putting together a bit of a feedback form, just in terms of how we take these meetings forward in the future, just in terms of how we manage the sort of channel of delivery and the topics, etc. So just to let you know, that form is now ready to be circulated, so I'm going to put it in the email with a recording, etc. So I'd be really grateful for your thoughts and feedback, just in terms of how we move this sort of meeting forward and what you want to see on the agenda, etc. So I'm just doing a plug again for that. Sorry, Carrie.
Not at all, not at all. Fantastic. Yeah, I mean, and that's the reality, is we're always wanting to kind of evolve this and ensuring that it's providing you with information that's useful, and if there's different ways that we can be engaging, then we're really open to it. So just let us know what you need and what would be helpful. So thank you for 3 fantastic talks today. So so thank you to Paul and Lindsay, to Louisa, and to Rob, and thank you all for joining us. Great numbers today as well. And yeah, have a lovely Christmas and New Year, guys, and we'll see you in the new year. Take care.
Okay.
Thanks.